Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Guys, this week we're in week 3 of our series for the month of February on the CPC review and my most asked questions. So if you have not yet had a chance to view weeks 1 and week 2, I have been able to put it in a playlist for you, so go back and review those questions. Today we're in week 3 and I promised you some CPT coding. But first let me answer a question that I get, and students are a little questionable about. Why is there ICD-10, PCS, and CPT? What's the purpose? Why? What is the reasoning behind it? And the best way that I know to describe it is that the facility has to get their money, the physician has to get his or her money. In the past, we had one classification, and with that one coding classification, when the reimbursement went to the hospital was expected to pay all of their employees, including environmental services who cleaned the room, maintained the hospital as far as any painting or any supplies that were needed, and pay the physician. Well, you know, somewhere the money ran out. Physicians got smart and came up and requested their own coding classification system so that they can be reimbursed individually. And I used to say, you know, one time you used to go to the hospital, you got one bill. Now you go to the hospital, you get a LabCorp bill, you get your physician office bill, you get the hospital bill, you get radiology. I mean, there's just so many bills coming in, and it's because so many hands are now in that one pie that have to be reimbursed. So anyway, physicians now, you are reimbursed with CPT, and the hospital is reimbursed with PCS. So when a patient comes into the hospital and has surgery done by a physician, that hospital will bill ICD-10 CM for the diagnoses and ICD-10 PCS for the procedure. And then that physician's coder will bill CPT for the procedure so that the physician can get his money or her money for the procedure, and PCS is performed so that the facility gets reimbursed for theirs. So again, that's why we now have CPT and ICD-10 PCS coding classifications, and that's why both codes are done during a hospital stay. Okay guys, hope I cleared that up. Now let's get started on this first day of our 3rd week. I have 2 questions. They're CPT coding, and I tried to stay in E&M. I'm going to try to stay in E&M this week. So these first 2 today are E&M CPT codes. So let's see what we've got here. Okay, your question says, patient is admitted to the hospital with acute abdominal pain. The attending medical physician requests a surgical consult. The consultant agrees to see the patient and conducts a comprehensive history and physical exam. The physician orders lab work to rule out pancreatitis, along with the ultrasound of the gallbladder and abdominal x-ray. Now, due to the various diagnoses possibilities and the test reviews, a moderate medical decision was made. So, is that answer 99244, 99222, 99254, or 99204? Okay, go back up to the question, let you view that, pause it. And these are your multiple choice options. Okay, let's look at number 2. Patient arrives in the emergency room via a medical helicopter. The patient has sustained multiple life-threatening injuries due to a multiple car accident. The patient goes into cardiac arrest 10 minutes after arrival. An hour and 30 minutes of critical care time is spent trying to stabilize the patient. Your multiple choice options are 99285, 99288, and 99291 is A. 99291 and 99292 is B. 99291, 99292, and 99285 is C, or 99282 only for D. Okay. Let me pause that question so you guys can view the question. And your choices. Okay, guys, I will be back tomorrow with the answer to these 2 questions, along with 2 more for tomorrow on CPT. And today's questions are on E&M, and I'll try to stay within E&M. Thanks, guys. I'll see you tomorrow.